Questions?
Governor, in a nutshell, how many people will get the test in each family? And can you give us an example of how you want them to be used? And will the state be notified of the positive results? Will it count in the number?
That was like a lot. Let me start. Let me start with this. Let me start with this. Part of our objective here was to make these available in communities where we felt there was, to begin with, communities hard hit by COVID, and secondly, as I said in my remarks, those communities that were had the lowest numbers with respect to our counts around income and that sort of thing. Places where they would really make a difference. Rather than defining specifically how those might be used in those communities, we decided to make them available to communities, those 102 communities, and let those communities decide what the best process for distribution would be. There'll be some broad parameters on it, but generally speaking, we want them to do what they think makes the most sense. With respect to rapid tests generally, they have proven to be a very effective tool, especially for people who are going to be gathering indoors with folks they don't, either they don't know or they're not normally around. And I think in some ways, that's probably heading into the holidays, one of the more important ways people could use them.
Will they count towards the official numbers?
I don't think they will, because they're not. There isn't a process in place for that. And keep in mind, you know, people have been buying rapid tests for a while. But one of the issues we wanted to deal with here was the fact that they're not cheap. And for us, the most important thing to do here was to make them available in those communities on a grand scale, that would make it possible for them to distribute them to a lot of the folks for whom the price tag is probably beyond their reach. I do think the fact that at some point in the not too distant future, communities will be able to replenish those orders and spend some of the federal money they've currently got, will make it possible for them to be a little more aggressive about how they think about distribution generally as we head into the holidays.
What can the other 250 cities and towns in Massachusetts who aren't part of this program do in order to get their folks tested?
Well, we're still doing 100,000 tests a day here in Massachusetts to begin with, and we're doing another 70 or 80,000 tests a week around our test and stay program to keep kids in school. This is what I would describe as one more testing tool in the toolbox, focused primarily on those communities where there's less likelihood that people have the ability to buy these on their own.
Governor, how far away are we, or is it even in the plans to do something like Colorado, where any resident of that state can go online and request a free rapid test through the state? Is that something you foresee in Massachusetts, or what other plans beyond this 2.1 million would you like to see?
I really think for us the big opportunity is to get the bulk purchase agreements in place with a number of these manufacturers and then make that available to cities and towns to order and then distribute within their communities in whatever way they think is the most appropriate way to make it happen.
Governor, if price is an obstacle, how much did it cost the state for the 2.1, and what price do you want to get it down to for state cities to get them to that bulk purchasing agreement?
Well, since we're in the midst of a negotiation with the manufacturers at this point in time, I'm probably not going to answer that question. I do think it's important for them to be as cheap as possible to the communities and to the people in Massachusetts who are engaged in this effort.
How much did it cost the state for this?
You want to speak to that? Sure. You asked about an open procurement.
I understand, I guess it's a two-part.
Right. So we spent $10 million for the 2.1 million tests.
Is that from ARPA money?
I used state appropriation dollars, and we will seek FEMA reimbursement for it.
Are teams going door to door with these tests today, or when are they going to have them in hand?
They'll be distributed to communities starting tomorrow and probably take 4 or 5 days to get them all out to everybody.
How accurate are these tests? Any false positives, false negatives?
The thing about antigen tests generally is their accuracy rates have improved dramatically over the course of the pandemic. I don't know the answer specifically to this one, but a number of the most well-known tests that sell in the community are north of 95% on both positive and negative test results.
Yeah. It's in the upper 90s.
Okay.
So this rapid antigen test, like other rapid antigen tests, right, are in the upper 90s in terms of effectiveness. So it's again, I think one of the positives of rapid antigen test is easy, use at home. In this case, it's for anybody 2+. It's a non-invasive process, 4 steps, highly effective. So we think it's a really good tool in the toolkit.
What can you tell us about iHealth Labs, this company?
U.S.-based, California. And it's one of the 8 or 10 manufacturers that has received emergency use authorization by the federal government. So there's 13 EUAs, and I think it's 10 manufacturers. So they're California-based.
Ms. Utters, is
Yes.
there a recommendation for when to take the test? Say it's Christmas, 2 days, 1 day before, any recommendation?
So again, I think the recommendation is if you're going to be in an indoor gathering with people like particularly you don't know, it would be a good, that's one good example of when to take the test. Whether it's like on Christmas Day or not, it's not really that's really not the construct. It's really like if you're going to be in an indoor gathering with people you don't know, not sure what their vaccination status is, that would be a good time to take the test.
Is that what the state is advising as well? Because, the CDC came out last week and said regardless of vaccination status, you should take rapid tests before going to your holiday gathering. You have people saying, I can't find them at CVS. So, can you speak to that just generally, rapid tests, holiday gathering, what do we do?
Well, part of the objective here is to make these available to many folks who don't necessarily have the financial wherewithal to do it, and to make them available so they can use them for gatherings of one kind or another. Let's face it, this time of year there are a lot of those kinds of activities, and I think what we're trying to do is to make it one more tool in the toolbox that can be used to make those events as safe as possible for people.
Governor, is there confusion around in the state of the building about whether it's the mask or not the mask? Is that still recommended? Some cities and towns have indoor mask mandate. Within this building, governor's staff, no masks, legislative staff, masks. It's a little confusing. Is that confusion going to contribute to maybe not getting things under control in the long run?
Well, first of all, 6 million people in Massachusetts are fully vaccinated. 1.5 million of those 6 million have received booster shots. 5 million people are fully vaccinated. 1.5 million of those people have received booster shots. Another million people have at least one dose. The fundamentally best and most important way for people to keep themselves and their family members safe is to get vaccinated. And if you've been vaccinated and you're eligible to get boosted, get boosted. With respect to mask mandates, we have public transportation as a mask mandate, long-term care as a mask mandate, public schools have a mask mandate, healthcare organizations have mask mandates, and then local communities, for a variety of different reasons, have put a variety of requirements and recommendations in place. This is about testing. And the most important element in this is about making tests, rapid tests, available on a broad scale to communities that have, in many cases, a lot of people who aren't going to be able to purchase these on their own, to make these tests available so that they can test themselves before they go to gatherings or other large indoor events. Well, today is the day, so we'll probably have more to say about that later.
Getting back to her question, what about people who can't afford them but can't find them? Forget about it?
No, that's what the whole point of this exercise is. There are going to be 102 communities that are going to receive 2.1 million rapid antigen tests, and they will then make decisions about how they think they can best be distributed in their community to make them available to their residents.
But if they're available to people who, let's say, can't afford them, or they think are difficult communities, what about those, as I say, who can't afford them, don't qualify for whatever programs are available, and can't find them at their local CVS? I mean, other states have been made them available more widely available to everybody. If these communities make them available with targeted communities, what do you say to the people who can't find them on the shelves? You can't afford them and want to buy them?
Well, the reason we made this deal was to make 2 million rapid tests available in 102 communities that represent 3.7 million people in Massachusetts who will have access to these tests for free. In addition, you came in late. In addition to that, there's also a contract that's being negotiated currently to make it possible for cities and towns in Massachusetts, all cities and towns in Massachusetts, to purchase these tests on behalf of their residents off of our blankets, and they can use federal funds to make those purchases.
Last question. Are there any plans to bring back the statewide mask mandate as doctors call on you to do so?
There are no plans to bring back the statewide mask mandate.
Are there any triggers that would tighten restrictions in your mind if you see cases go up?
Keep in mind that we're in a very different place than we were in before. 5 million people are fully vaccinated, 1.5 million of those are boosted, over 6 million people have at least one dose, and we continue to focus aggressively on those communities and those populations that are most vulnerable. There's a ton of activity going on in that space to keep those people safe. They're tested all the time with respect to COVID, and that's going to continue to happen until it doesn't need to anymore.
Insight on breakthrough cases with vaccinated people, breakthrough cases. Can you give us some insight why that might be happening more so? We're seeing those numbers go up.
Well, keep in mind that we've said this for a long time. The vaccines protect against serious illness and death. And I've also talked about the fact that if you look at the hospitalization rates of the vaccinated and the unvaccinated in Massachusetts, if the unvaccinated got vaccinated, it would drop our hospitalization rates by 50%. There's simply no question that the vaccines work. And if you look at the national data, there were about 120,000 people in the hospital with COVID at this time last year with very similar case counts nationwide. This year there are 60,000. The main reason there are so far fewer people in the hospital this year than there were last year, with the presence of Delta and all that comes with it, is because of the vaccines. Get vaccinated. If you're not vaccinated, get vaccinated.
Thanks, everybody.
The hospitals activated National Guard, are there any plans to activate here with this surge and the surge?
We're in pretty constant conversation with the hospital community about what makes the most sense here, and as I've said, if there are ways we can continue to support them, we have made a series of decisions based on those conversations with them to give them more flexibility around how they operate. We'll continue to pursue those.
Governor, the city was doing was ordered to return $650,000 in COVID federal funding, $500,000 said to be distributed and properly given as bonuses. Can you tell us about what that's about and if there's going to be an investigation into, I guess, the improper bonuses?
Well, if they give the money back, I guess what I would say is, first of all, we spend a lot of time with our colleagues in local government around what's permissible and what's not, and we want to make sure that they put those dollars to work in ways that are federally qualified, and this conversation we're having today about rapid tests is a good example of something that is reimbursable and they can use their federal resources for. But obviously, in those course of those conversations, if we come across things that we don't think meet the test, we're going to work with the locals to make sure that they figure out a way to correct for that.
Thanks, everybody. Will the state be opening more traditional testing sites for those who can't access these rapid tests? Just as we head into the holidays, and additionally, are we going to have more high-volume booster sites? I know that those are coming. Are some of them already online? Just can you just quickly update?
Well, there are hundreds of booster shots available in Massachusetts today, and there are hundreds available tomorrow, and hundreds available the day after. We're checking those sites on a pretty regular basis. It may take a few days for somebody to get an appointment scheduled, depending upon where they live and when they can go. But we've continued to talk to our colleagues in local government about working with us to set up additional sites in places where we have a lot of traffic and a lot of activity. There's not a shortage with respect to available boosters. The issue for us is creating capacity. We have over 1,000 sites that are currently available. We're going to continue to work to see if we can build on that going forward.
So for testing, like just your swab testing sites, are we going to see more of those traditional or just?
100,000 tests a day is about the max we ever did at any point during this pandemic. The 38 Stop the Spread sites are all located, for the most part, in communities where folks don't necessarily have the resources to purchase their tests on their own. And if they can't find one, there are hundreds of testing sites available around the Commonwealth that people can access to get tested. But putting 2 million rapid tests into the mix focus primarily on those communities that have got the greatest need is another tool in the toolbox to spread testing infrastructure more broadly. And once we negotiate these deals to establish a statewide framework for this, all communities in Massachusetts will have access to that. Thanks, everybody. Thanks, everybody.